Do you struggle with erectile dysfunction and you're not quite sure why? I'm Dr. Trish Leigh, brain health coach, cognitive neuroscientist, and sex addiction recovery coach. I want you to know that if you struggle with erectile dysfunction or delayed ejaculation, it is related to your brain performance pattern. So we know scientifically that if you're caught up in a pornography habit, or even if you've left one behind, what can happen in your brain is that it has been exposed to a dopamine dependency, which means that it's shifted the level of dopamine that makes it feel good. It needs high levels of dopamine to feel good and to become sexually aroused. What that does is it shifts your baseline arousal in your brain. So now it's difficult to be aroused by a partner. And if you're able to become aroused, it's difficult to move towards orgasm because your brain needs very high levels of stimulation. So if you struggle with erectile dysfunction, at the core is baseline arousal dysfunction that we can see on a QEEG brain map. It's measurable, it's definitive. We can see it, and when we see it, then we can see the route to being able to get to that underlying brain pattern and to regulate it back to the optimal pattern so you can feel calm and focused throughout your life and be able to become sexually aroused. So if you want more information, please go over to drtrishleigh.com. I would love to help you. I work with so many men who struggle with ED for years, and it's a matter of identifying it in their brain and regulating the brain back to the optimal state. These are not my ideas. I'm just the messenger. This is what science shows. If you want to know more, please go over drtrishleigh.com. And until next time, control your brain or it'll control you.